The manipulation was just done an hour ago.
I want to introduce the following clip. So this was a patient I saw today. He was a patient of mine previously, but not for the total knee replacement. He had his knee replaced. He went through rehab. He had a complicated recovery. Now today, literally an hour before you see this video, this patient was having a manipulation under anesthesia. So this is the first time that I'm seeing him. He's 6 weeks post-op. He had the manipulation today, an hour before this video was recorded. Check it out. And at the end, let me know if you have any questions. Post them in the YouTube comments. Thanks for watching, guys. Okay, so do you know why you're having the pain across that? So because you don't have the extension, because the knee can't go straight, all of that pressure is going into the foot. Your heel doesn't get the full contact. So when you're walking, it's like you're walking on the ball of your foot the whole time. So all of that stress is coming up into that high arch. Some people will get it up into the ankle also.
It's more towards where that bow is, right in through there.
Yeah,
right in
that's
through there.
where all that pressure is going. As the knee extension improves, that will get better, no doubt. Okay, so the manipulation was just done an hour ago. I'm gonna give you this little tool. So that's just a little wheel. It's a caster from underneath a chair. What I want you to do is I want you to massage through these muscles. I would hold it kind of like this.
Okay.
So go ahead and grab that. Perfect. And I want you to massage all through the inside. So that response, right? That jump. That's what we want to desensitize.
Okay.
You can use a rolling pin for it, but I like this small surface area and it gets more point specific. What I want you to do, there's a timer, I'll reset it. I want to spend about 1 or 2 minutes getting all through here, and then I want to spend another 1 or 2 minutes working on the outside.